With this series, one of the reasons why we said we need to start doing this because so many people were like, I want to know what to do if something happens. Who do we call? Where do we go? What do we do? Um, it's all those pieces that we need to dig into. And so when I heard about Count the Kicks, I was like, how many of us are just like understanding that we should be talking about how is the baby doing? You feel the baby moving? Why is that important to even have that discussion with someone as a friend, as a doula, as a healthcare provider? Tamika is here to really talk about her personal journey, but she is a Count the Kicks advocate. And she is going to take us through some basic pieces around Count the Kicks and how we can really implement them. So let's give it up for her.
Thank you, thank you, thank you.
Got
It's
some
so nice.
emojis, all that stuff. So,
Nah.
you again know someone that's pregnant, have friends, different people that are here, out and about. You could invite them to these advocacy spaces where we're going to open up real conversation for real people making real change. So, I'm gonna give the space to you, Tamika. Please introduce yourself and tell me why you were involved with Count the Kids.
I will. Thank you so much for that introduction, Stephanie. Again, I fell in love with her the first time I met her. Her voice is so powerful, and just the advocacy that you guys do in Washington. I mean, y'all had a whole crew in DC that time. Yeah, I mean, like y'all had a whole
We
crew.
went deep. We
So
went deep.
y'all
We were
did.
able to
Y'all went
take
real deep.
we took
But we had
15 people, all expense paid for advocacy to Washington, DC at Mom 2020. It was awesome.
Yeah, it was really awesome. And that part of advocacy is super important. And I didn't really realize that until I got into the space. So I'm Tamika Isaac. I am based in North Carolina. And in 2018, me and my husband were pregnant with our only child and our first son, Jace. Um, and I had a really, really good pregnancy. I thought I did. I didn't have morning sickness or any of those things. Very few cravings. I probably gained about 25 pounds while I was pregnant. I didn't have any pre-existing conditions or anything like that. But they told me because of my age, so I was 40 when I got pregnant, that I would be high risk for preeclampsia. So they put me on a low dose of aspirin, and that was pretty much it. Other than that, I became anemic, so I was on iron pills, and all my ultrasounds would be done at maternal fetal medicine, which, you know, for high risk. But other than that, pregnancy went really well. And about 34 weeks, I had gone in for like a regular appointment, and they told me that Jace was measuring small. So they sent me to maternal fetal medicine to do an ultrasound, and it was inconclusive because he was blocking the umbilical cord, so they weren't able to see. And then the next week, I went back for another appointment. So I'm in my third trimester. I'm at 35 weeks. Go back to another appointment. Doing the weekly appointments at this point. Go to my next appointment. He failed a non-stress test. They sent me back to maternal fetal medicine. I did another ultrasound, and they told me he was fine. This was on a Thursday. That Monday morning, like in the wee hours of Monday morning, I had a really bad stomach ache. I woke up. I tried to poop, couldn't poop, ended up throwing up. In my mind, I thought I had food poisoning. I had mixed a whole bunch of food that day. And it was Mother's Day, so you have a big dinner. I had ate a lot of food, and I hadn't had morning sickness. I was like, "Haha, funny God, you're you're doing this to me now." But after I threw up, I actually felt better and was able to go back to sleep. When I woke up the next morning, I had some soreness in my abdomen, which I related to throwing up. I hadn't thrown up in years, threw up, so I'm like, okay, well, this has got to be from throwing up. But I didn't feel well, so I kind of laid around in bed. I One of my best friends was there. She about later in the afternoon, I realized I hadn't gone to the bathroom. So I asked her to come help me because I was still feeling this soreness in my abdomen. I went, she came up, she helped me get up, and when I stood up, I passed out. And so at this point, I'm rushed to the emergency room. We get there. By this time, my husband's there. He was at work. We get there. They do a Doppler. They don't say anything. They come back and do an ultrasound. I got there at like 6 p.m. They do the ultrasound at like 7:50 p.m. And they look at me and my husband and tell us, your son died in utero. Very matter of factly, point blank, no emotion, no empathy, no anything. But we didn't really have a lot of time process that, because the next thing they told me was that I had a HELP syndrome, which I had never heard of before, nor did they explain it to me. So they were like, "Oh, we need to transfer you, we need to induce you." And I asked for a C-section. I was like, "You just told me my son died. I can't do this. Like, I can't push him out and not hear him cry. I just know mentally I will never come back from this." So they told me they couldn't give me a C-section, but they had to send me to another hospital. So we waited for transport for another few hours, and then they finally transported me. As I was in transit, they realized I was bleeding internally. So now it's an emergency. Now I have to go in emergency surgery. I'm willing to OR. Turns out I had a liter of blood in my stomach and a softball-sized blood clot on my liver, and I was dying. They cut me open, took Jace out. Um, I was hemorrhaging, so I was bleeding profusely. I was not clotting, because with HELP syndrome, one of the symptoms is low platelets. So when I was bleeding, it was like water pooling. I had transfusions and all these things. I ultimately was in the hospital for 45 days. I had 7 surgeries. I just had an 8th surgery this year, which actually fixed a hernia that they gave me during the other surgeries I had in 2018, that I paused, put on hold for a while. Whatever. So this journey actually led me into advocacy. After I finally got out of the hospital, I started doing some research, mainly looking at my medical records, because your first thought is like, what did I do? Or what did I do wrong? Or what didn't I do right? And so I was going through those motions, like, what happened? Like, how did we get here? I was fine, he was fine, and then we weren't. And I realized, like, during my pregnancy, and what I didn't know about preeclampsia at the time, and I know now, which is also something that's with HELP syndrome, is that protein in your urine is a sign of both of those. Unfortunately, my providers never did urine test on me the whole time I was pregnant. So they did a urine test to verify that I was pregnant, but never did another one the whole time I was pregnant, even though they told me I was high risk for preeclampsia. Still baffles my mind to this day. Um, and that information floored me. I was completely devastated. So this is kind of how I'm walking into what is the Black maternal health crisis. This is how I find out about it. And I just knew, like, the trauma that me and my husband through was it was unbearable, and I never wanted anybody to have to go through that. My poor husband was diagnosed with PTSD just because, he had lost his son, and then they're telling him, "Hey, we don't know if she's gonna make it either." And he has people coming at him from all directions, talking about all the things that they have to do to me. And that poor guy, he just, he had to deal with it. And then he also had to grieve our son alone because I wasn't conscious. So this actually led to a nonprofit that we started in 2019 called Jace's Journey, in honor of our son and to bring awareness. So, and what I've learned is that I didn't know enough about being pregnant to be pregnant at the age of 40. I didn't know I needed a doula. I would have loved to have one. I really believe with my whole heart that had I had one, my outcome would have been different. And these are the things you learn after the fact. I didn't think about stillbirth. Nobody talked to me about stillbirth, even though I was high risk. And just like you're high risk for pregnancy, the older you get, you're high risk for stillbirth, but nobody has that conversation. I became an ambassador for Count the Kicks because of those reasons, because people don't talk about stillbirth and the risks associated with stillbirth. People don't talk about their losses. Like, it's still kind of shunned in our society, especially in the Black community. We don't talk about it that often. And I didn't want to be the person that just kind of went into the closet and never said anything else. And I didn't want my son's death to be in vain because I now knew that it was preventable. And Count the Kicks is one of those things that I came across in some of my advocacy work. So there's a stillbirth working group that I was a part of, and we did kind of like a patient story, like parents with lived experience. We kind of had a convening and we all kind of shared our story. And that's how I actually was connected with Count the Kicks. One of their diversity people at the time actually reached out to me to present at a Black maternal health webinar. And the more I kept hearing about this app, I was like, that would have been a game changer, because I remember like when I was wheeled into the ER or when I was sitting in the ER, one of the doctors said to me, like, when was the last time you felt him kick? And I couldn't answer the question. Like, I didn't know I should have been monitoring fetal movements because the reduction in fetal movements is actually an indicator of something being possibly wrong with the baby, but also wrong with the mom. So Count the Kicks can
Mm.
help you uncover a couple of things, right? And it's a very simple, it's an app. Like, it's an app. And if you are in locations that are more rural, they have a paper thing that you can download. They also have a bracelet. And you guys are lucky because in the state of Washington, you actually get the brochures and pamphlets for free, because the state has already opted into funding Count the Kicks throughout the state. So if you go on the website and order, you can order things for the state for free. Um, Unfortunately, North Carolina has not bought into it. And that's one of the things I advocate for here, is trying to get $150,000 to implement Count the Kicks across the state, to where any provider, doula, anybody in the state of North Carolina can actually just go on the website and order brochures for free. Another part of the advocacy, or what another part of what being an ambassador is for Count the Kicks, is doing this, right? Telling people about Count the Kicks, going to baby showers or any type of health fairs, having a table there, and just letting people know about it, because it's a very simple free app that has saved hundreds of babies. And just to give you backstory, so Count the Kicks was started in 2008. There were 5 moms in Iowa who bonded over either having a stillbirth or infant loss, and they wanted to do something to help prevent stillbirth. So there was some research out of Norway that indicated, like, if you count fetal movements and start counting fetal movements in the 3rd trimester, it actually reduced the stillbirth rate. And Norway was able to reduce the stillbirth rate by 30% by counting fetal movement. So the Count the Kicks app was created in 2008, and then in 2009 they started the organization called Healthy Birthday. So Healthy Birthday is the main organization, and then Count the Kicks is a campaign within that organization. So what the app does, it's a very simple app, and if you've ever seen a brochure, I don't have one on me, but a brochure, it's very Dr. Seussy. So it's very colorful. The words are very simple, and literally it's an app on your phone, and I can kind of show you the app on my phone. And it literally, you count how many times your baby kicks, so it's 10 kicks in whatever time it is. And what you're trying to do is create a baseline for your baby. So if we talk about myths that we've heard, so some of the myths is that your baby's supposed to kick 10 times in 2 hours. That's outdated. So what the research has shown now is, like, a baby's movement is really based on the baby. It's not based on any particular time frame. It's not the same for everybody. Some babies move faster, some babies move slower. It just depends. And what the Count the Kicks app does, it creates that baseline for you. So when you start using the app, you use it in the 3rd trimester. So you start at 28 weeks, or if you're high risk, you would start at 26 weeks. And the app actually, you just you put it in, like if you're having multiples, if you're having a singleton, and if you're having multiples, you'd have to you do it twice. If you can determine, like a lot of people know which baby's kicking. So it can help you determine which baby is actually kicking and their frequency per child. So it even helps you do that. The app actually comes in 20 languages. So it's a lot of languages. So you're able to choose your own language for wherever area you are. And there are sometimes rural areas that don't have as, good a service, but they do have a bracelet. So the bracelet, you just kind of hand time it, but it has the numbers like 1 through 10. So you count it, and then every time you just move it to the next number, and you move it to the next number. And this bracelet is actually free in Washington State. There's some like shipping problems at the moment, but you're still able to get this. I think you can only order a pack at a time. I think a pack comes with 25 in it. But this helps you if you're in a rural area. You can still count. You can also download like a paper counter that you can put on your wall and use it that way. You could use the app. You could use the bracelet. And I think there's another way. I have my notes here. I know I always miss something.
I
I
just
have to.
I have to stop you really quick. Okay,
Okay.
first of all, if you all are excited about what you're hearing, give me a little snap, a little clap, something, anything, emoji. Like, how practical is this?
It's so
Every
simple.
person gets a wristband. That's as simple as that. Every person gets a wristband. When you're a doula or you're working with someone, third trimester, there are certain tools that you need to implement and they're free. And I just want to say, Shades of Motherhood is going to purchase a ton of this stuff. Any shipping, if you want some of this stuff, we will purchase it. The second thing that I want to say is the brochures, they are downloadable and you can print them off. You can come to our office and we will print them for free for you so that you do not have to worry about, any of that stuff. But this is huge, simple, so simple. I just have to say this. I'm like, pump up.
No, it's completely simple. And just to give you an idea, so they started it in 2008. Within 10 years, they reduced the stillbirth rate in Iowa by 30%. Within 5 years, they reduced the stillbirth rate in African American women by 39%. And the research was already there, right? Because Norway did the same thing, right? They were able to do the same thing. So they've already done it. And the goal of Count the Kicks, like what they're trying to do is get in every state in the country. And if they're able to get in every state in the country, we can save 7,500 babies a year. And a lot of people
Can
don't
you say that
realize
number one more time?
7,500 babies a year. And a lot of people don't realize that stillbirth and infant mortality are not the same.
Hmm.
And that's something I had to learn because I wasn't aware of that. A lot of people think like the stillbirth numbers are calculated in the infant mortality numbers, and those numbers aren't the same. So stillbirth happens almost as much as infant mortality, if not more. So where we have like 21,000 stillbirths in the country a year, infant mortality, they're about neck and neck, but those numbers, the research is only really for infant mortality. If you go to like your health numbers, they don't really try to research stillbirth. So a lot of legislation, so we talk about advocacy and what we're doing. The simple that and it's like Stephanie said, there's simple tools. So one of the simple things that we did, one of the simple things that Healthy Birthday did was get the word stillbirth into legislation, because stillbirth was not in legislation at all. So every year HRSA gives each health department in the country, or DHHS in each state, funding. It's called a Title V block grant. That money is allocated to like infant mortality research and infant mortality prevention, if you think about Safe Sleep and those campaigns that everybody knows about, that's where that money goes. Like, what's the, I can't think of it. Okay, it'll come to me later. But that money goes to those things. But in that grant, in that legislation, the word stillbirth wasn't mentioned. So it talks about infant mortality. So Healthy Birthday introduced a bill, I think 2 years ago, to actually just put the word stillbirth in it. So the states could now know, like, hey, we have this money. We can now use this because it's in the language for stillbirth prevention. And luckily, we were able to get that passed this year in June. In June, we were able to get that passed this year. And me and my husband were very fortunate to be a part of a roundtable at the vice president's office to celebrate that win, right? Because again, something simple, just the word stillbirth, to even be able to start putting funds towards preventing it is huge. So with the Count the Kicks, it's a really simple, very simple tool. If you're able to download the app, what they'll do is put in their information, and they don't share data, just so y'all know, they don't share data or anything like that with people to get, oh my gosh. Where, okay. So can y'all see my screen? Yeah, okay. So literally it asks you like, what are you counting? So I have one, and then it has a little foot. And what you do is tap it every time you feel a kick. And we're talking about punches, jabs, rolls, things like that. Hiccups don't count because those are involuntary. So every time you feel it, you just tap the foot and it counts it. You feel another one, you just tap the foot until you get to 10. And however long it takes you to get to 10 is what you're looking for, right? So what you do is you do that at the same time every day. Again, in your third trimester, you want to do it at the same time, usually when the baby's the most active, right? So whenever the baby's the most active, you do that, and then you create your baseline. So once you create that baseline, you compare the days, like, oh, well, we were here on this day. What are we now? And if you see a change in that movement, that's when you go get help. That's when you go to your doctor. That's when you go to the emergency room. That's when you say, hey, and then you have the proof. So this app not only counts your baby's kicks, monitors your baby's fetal movement, it also gives you the proof, right? Hey, I've been doing this for however long I've been doing it, and I've noticed a change in my baby's movements. Please check, right? So it not only counts, it gives you proof, it also empowers a parent, right? It also creates a bond with the mom and the baby because you're paying attention to those counts. You're having that mommy me time, counting your baby's movements, and you guys are, it's a bond. So that's why I was like, look, this is a no-brainer for me. North Carolina is one of those states where we have to pay for brochures as an ambassador. If somebody asks me for a brochure, I can get those brochures for them for free. I've talked to health departments. I've talked to like high risk case managers for pregnancy through Medicaid, just to get everybody on board. And so that as an ambassador, that's what we do. I think that's pretty much the overview of Count the Kicks. Questions?
Oh my word, let's open up the floor. I'm
So
so
beat yourself
excited.
up.
I'm pumped about this. And I just have to say this part. How phenomenal it is that you coined this phrase of mommy and me time. Count the kicks, right? Just saying like, let's did you get to see your baby today? Did you bond with your baby today? Did you connect with your baby today? And be able to say, yeah, I did my little count the kicks. What did you learn? Having those kind of conversations to empower people to start that bonding at such an early time.
Mhm.
And right away, I want to give some ideas about this mommy and me time in the womb. One of the things that I talk a lot about is putting music to your belly. So getting some headphones and planning out your mommy and me time. So that way that you can get that baby can get some type of connection or bond with mom. And sometimes people are so worried about that bonding time with their baby after they come, but they don't even realize that they can bond with their child in the womb. Um,
Yeah.
I want to open it up. Please feel free to take yourself off mute. I also put a link in the chat. Please make sure you sign in to make sure you receive materials. We're going to have a lot of different little giveaways and things like that around this. I've also put a ton of links, all the different places that Tamika suggested for us to download the link, the app, making sure that we know where the store is so we can download those brochures, and healthybirthday.org as well.
And also on their website, there are plenty of baby saves in this country. They've saved babies in 36 states in the country. They've saved babies in five other countries, 5 countries total. So if you go to their website, they have a list of babies you can see their stories. We had one recently in North Carolina. The original one was, I think, Ruby. She was on Good Morning America, and that's kind of how, like, once that happened, a Healthy Birthday, Count the Cakes, like, catapulted into like space. So they got so many followers and so many people were, trying to download the app. They got, I think, over 400,000 downloads just off of that Good Morning America piece. But there are plenty of baby saves. The people who share are usually on the website, and you can just kind of scroll through and see all the babies that have been saved through the app.
Um,
Y'all don't have no questions. I don't even believe it. I don't believe
and
it.
So I
and
stopped doing exercise.
story sharing is
So,
also open too.
so I still. So I heard
Yeah.
she was.
I want to say thank you so much for sharing your story with us today and being part of this life-saving cause for sure.
Thank you.
Because helping mommies, it really helps them to feel empowered. I have shared this with mommies. I love the bracelets. It's a physical reminder
Mhm.
because, I've always taught mommies, okay, I want you to, maybe log in, like write it down, how long it takes you to feel 10 kicks. But for that mommy to remember every day at the same time, it's been much more practical and easy for mommies to really be aware. And, I really share with them that it really is it's just an empowering, simple tool.
Very.
Yeah.
I agree with you. Thank you for that. And like, I've heard this. I was actually talking to someone, and I was voting, and she was pregnant. I was like, hey, make sure you download Count the Kids. And this is one of the things that a lot of people say, oh, my baby is very active. And I think, like, when you hear people say that, like, that's great, but you want to know how active, just in case you ever realize when they're not active. Like, that's the whole point of it. And I think people a lot of get scared sometimes talking about stillbirth, but I would rather for you to give me information to help me prevent stillbirth than me finding out about stillbirth after it's happened to me. And that's what happens to a lot of people. Like, doctors don't ever mention it. They don't talk about it. So a lot of people don't know about stillbirth or think stillbirth's an option or a possibility until they're faced with it. And and part of what I want to do is educate. Education and information is the key to all of this to me. We have to be more informed, because the more we know, in my opinion, the better decisions we can make for us and our families. So however you need to say it, I say it, but just make sure they understand, like, hey, this can save you as well, because my doctors didn't think anything was wrong with me. and I was dying, like literally dying. So it not only helps save the baby, but it can detect things going on with the mom.
Right. And I'm glad you brought up that, it was such a seemingly perfect pregnancy, because I tell mommies that could be the dangerous part. When, recently, on a different note, I had a young lady complaining about chest pains. And I asked her if she spoke to her doctor, and she said yes. And they just totally ignored her. And I said, well, that's because you're not overweight and you're only 20. I think she's about 26 years old. And I said, but 26-year-olds do have heart attacks. I need you to let your mother know. I need you to press them, and I need you to see a cardiologist. So with you having a perfect pregnancy, it happens often. So the counting the kicks, I let the mommies know that everything is going great, and that's wonderful, but please do this for me. Do this for you, do this for your baby. Because looking great, looking like nothing's wrong, when everything is lining up, that's still not enough.
Agreed. Thank you for doing that too. That's amazing.
Hi,
Okay.
Tamika
Hi.
and Stephanie. This is Ananda in Boston. There's a few of us here
Welcome
from
to our
Boston.
space.
Hi.
Thank you so much. I get the newsletter and I saw that this event was happening, so I told my colleagues about it, and there's a few of us here. It was actually a little bit hard to find a workshop like this.
Oh,
I
really?
I was surprised.
We should do
Yeah,
that more. I'll
Oh
tell
yeah.
them.
yeah,
Oh yeah.
Yeah, I'll tell them.
yeah, yeah. And I have some questions, which I'm trying to figure out how to formulate my questions. I've seen on the internet that some people are kind of questioning kick counting, and they're saying that their doctors are telling them that it's not necessary. Yeah.
Okay, I'm not even
And
gonna say the first thing on my mind, but
yeah.
what have we learned? I don't say what have I learned, right? We've already proven that it works. ACOG's on board. There's millions, and if you go to the website, there's articles, there's research. It's already been tested. And to me, why are you preventing me from doing something? What does it hurt? You know what I'm saying? Like, what does it hurt? It's not invasive. What does it hurt? And I think, we talked about like what you guys are doing in Washington State with the doulas and the hospitals and having those conversations. This is another conversation that we need to have, because
Mhm.
you guys aren't technically detecting the things that you need to be detecting anyway. So what does it hurt?
Mm-hmm. So did I hear you just say, Tamika, that ACOG is on board? That's really
Even
interesting. And
if you look at the Hear Her campaign, it talks about fetal movements in the Hear Her campaign.
Yes.
okay,
And I
I'd
was
love to
just
take a look at that. And it's just
We
so
I think we
interesting
linked
to,
to that on the website too.
okay,
But I can send you
I'm
the
gonna look at
deck.
those.
I'm gonna post it into the chat.
Okay,
We
thank
are
you.
actually gonna be
Something
doing
that's,
this campaign, so I'll put it in there.
it's
Yeah,
just
so
so
the
interesting to me
CDC
that
talks about it. I'm sorry, I didn't mean to cut
oh,
you
that's
off.
wonderful. Thank you so much. Yeah, just as for Black mothers, we we either, we receive more than our share of under treatment, which is what this is, and we receive more of our share of over treatment.
Mm.
Women saying that they were coerced into procedures, cesareans, things that they didn't want. So it's just amazing that we receive both ends of the spectrum, over and under. But this and this it's I'm just really interested to learn a little bit more about why you know, so there are so many procedures that one group will be in favor of and another group will say it doesn't matter, and it sounds like just like anything else this could be vulnerable to that. And so the more we know about it as
Mm.
doulas, the more we can say, well, I hear you saying that your doctor um, felt that it wasn't necessary, but let's get more educated about
Yeah,
this. So
and
I would
again,
love to just deepen my education so that it's so that so if someone does comment and say, I was told I didn't need it, the conversation doesn't have to stop there. You know, it's like,
right.
let's keep talking about it. And
And I'm curious as to why, like what the response is of why you don't need it. Because I'll share this with you. So ACOG actually did a recommendation about urine tests in pregnancy. And the recommendation was you don't have to do it. It was supposedly low risk patients. You don't have to do it because it frees up time for the nurses. And this is one of the things I said when we had that convening for the stillbirth working group. I was like, we take this is what baffles my mind when it comes to maternal care and ACOG and all the things, because there's no consistency. They always talk about a standard of care, but to me, in my opinion, there's not really a standard of care because everybody does something different. We have an organization here, they do urine tests every time somebody goes into the doctor. And then we have another organization here that doesn't do them at all. And you're just like, and you should know that my background is in risk management. So if that gives you any idea of how I look at things, that's the way I look at them. So for me, going to an OB, being told I was high risk for preeclampsia, now knowing all the symptoms of preeclampsia, then now realizing I went 8 months without a urine test and protein in urine is a symptom of preeclampsia, where are the checks and balances? So if we're taking away all these things, if fetal movement's not important, then why does the app work?
I I want to just get a showing of hands. How many people on here are doulas? If you can raise like either your little hand or make like a emoji, heart, something. So there's an interesting discussion about everything that we're doing right now. We just had a hypertension training that was led by a nurse practitioner that was phenomenal. Every doula that came, we gave them a whole package of high blood pressure kits, information, tools. She said something really interesting, which was I had a midwife reach out and she was like, this really isn't in a doula scope. Why are we doing this? And we immediately were like, you know what? First of all, we're going to learn how to do this stuff because we don't know when we're in a situation when we have to use this, right? But the nurse practitioner said, you guys are the eyes and ears of our community. If you don't know what to do, you cannot educationally demonstrate something to help people be successful in advocating for themselves. A lot of times when we think of advocating, we think of the confrontation, the wordsmithing, but we also must understand that when we look at that blood pressure and we help them understand how to take it, we are we're breaking generational curses for a lot of people. They are able to understand how to use the blood pressure cuff and passing that down to their child, because one day they may have a child who has high blood pressure and they're not sure what to do, and they need to do that and show them how to do it. Or it may be a friend or even somebody, you know what I mean? We know that there are so many people that don't know what they're looking at, and they're going through pregnancy not knowing what is going on. Everybody has come through birth, but nobody understands what it is. That is the most mind-blowing thing ever. And so when we look at doula work, we're actually talking about prevention work. We can't just be reactive work. People keep thinking that doulas deliver babies, what if they said doulas are educational and emotional support individuals who know how to bring the right tools to a person so they can choose what they want to do. And a lot of times when they're going to their doctors, they're talking to them for 5 or 15 minutes and then they're out the door. Tell me, what tool did you receive from your doctor today? We're going to be starting this campaign called Say the Word Doula. And we need these doctors and nurses to go into spaces and say, do you have a doula? I am not going to be able to support you emotionally and physically the way I want to. So we need to put together proper dream team for your birth. And that is where the shift and the change of power comes in. And then we can start having a larger conversation about a healthcare community versus healthcare systems, because those are going to take time to dismantle. But you can create a community that is raising up a person and is protecting a person, whether they have a great birth or a birth that was not expected.
Wow.
That's beautiful.
That's amazing. Like that was everything. I'm moving to Washington State.
Let's
Except
go.
Except for it's dark at 3:30. I can't do that. But no, everything you just said was just like, yes, absolutely. Absolutely. And I think I had a case a couple weeks ago where we also need to make sure that doulas are ready, right? Because I think they put so much into like doulas that people just want to be a doula for a fad. And it's not fad work. I literally had a mom who ended up with shoulder dystocia at home after her membranes were swept. She was at home. She had an assigned doula through United Healthcare, and she couldn't push the baby out. The doula never called 911. And her response was she was overwhelmed. And this baby passed away. Like her baby passed away because she wasn't able to get to the hospital in time. The baby died at home. And I know the power of a doula. And I know that that person was not made to be a doula. You wanted to be on this fad, this bandwagon, and we have to make sure that the people we have supporting people are ready to provide that support. But everything you said, Stephanie, was just on point. Like, yes, say the word doula.
Yeah.
Let's have these conversations with providers so they understand that they can't give that support. That's why doulas are important. This is not a competition. It is not a competition. And I think we see a lot of that here. I think the conversation is beginning. We're working with some, again, healthcare systems here in I live near Charlotte, North Carolina. Here in Charlotte, North Carolina, getting doula programs embedded into the system and trying to figure those things out. But it's a lot of not understanding, right? Not understanding and thinking it's a competition and I'm in the way and I'm gonna have, like we're gonna be confrontational, and that's not what it's about. So all those things. I love what you guys are doing. I love the Shades of Motherhood. I think y'all do amazing work. I'm so happy. Goodness gracious.
I'm so grateful for you being a part of this. We believe in collective work. And this year, we're really going to be pushing forward with a lot of pieces. All of our doulas are pretty much independent doulas, and we help fund them so that they can provide 6 free services in the community a year. A lot of our doulas do over that, so we just continually find funding so that not only are they provided with sustainable living, which I feel like that's still not enough, what we give, which is $1,200 per birth and postpartum care. We want to up that as much as we can. But we're getting ready to start the conversation of, is this effective? Are people really seeing a difference in their care because they have somebody walking alongside? And so I want to, it sounds like no one has any more questions or comments. Does anybody want to say anything? We have some great comments over here in the chat. I posted this new t-shirt that we just made called In My Hands, My Body, My Choice, My Doctor. And we are reminding people that we chose you. So if we're choosing you, we need you to choose us and choose to fight for us and choose to be in our corner. And so I did see here, is there a question? I feel like there was a question here. Nope. Okay, those are just comments. Okay. So, yes. So I just want to thank everybody for coming. We are going to be having a ton of these events online. We need as many people as possible to join this movement. We want to be able to support other people in different states and cities, and specifically our city, Spokane, Washington, to help not only prepare our doulas, but to help them understand the power of a doula. We also want to remind everybody, please make sure you click on that Google form to sign in, put all your information. We want to send you some goodies for today. I just want to say thank you so much for being a part of this conversation. Remember, if you need the bracelets that have the numbers, I looked on here, it allows you to order 25 of them at a time. We will be ordering some locally, but if you want to get your own, you're more than welcome to. And then also too, you can print off the brochures if you need to in Spokane. And for my folks that don't live in Spokane, if you would like us to print you off some, we could send you some because we want you to feel prepared and we want you to go out with confidence. Thank you so much. You're also going to receive a short survey. If you were really inspired by this conversation, we want real life people coming to the table, sharing their story. What could you have done different with your doula practices? What could you have done different in your doctors and nurses spaces? Let's go. Let's have the conversation. Let's make it happen and make change happen. So thank you all so much. Tamika, thank you so much. You
Oh.
know I love you so much.
Oh,
You just
same. I do
so
want to say
much.
one thing. I do want to
Yes.
say something else. So,
Yes.
what my organization does do, Jace's Journey,
Yes.
if you come across a mom that has actually lost a child in your experience, please contact me. I will send them a support box, just to let them know that they're not alone. It's a very isolating experience when you're in the middle of it, but once you know that you're not by yourself, even though it doesn't change the loss, it does help you feel in community, right? So we do like to support people with our boxes. So if you come across someone who has experienced a loss, just shoot me an email and I can send it to them, and it's free. You are able to purchase them, but my goal is to donate them. Just let me know.
So
And
I just want to
go
put a
ahead.
plug in. If you want a box and you want her to send you one, we will create a piece of funding that will go to you, Tamika, to send. So if you have a mom that is needed to be supported.
I think somebody said
Thank
something.
you so much for everything you shared.
Jace's Journey.
Oh, and I just put the her website in there too.
How did you? Oh, can
Mhm.
y'all also do me another favor? We're in the running for this grant,
Let's go.
and we
Ask,
need
Megan,
votes.
ask,
We need votes. Hold on. I'm gonna put it in the chat.
Yes, drop all the
please.
links. Can we get your email too in there?
Yeah.
Yep, I'm putting the email in right now.
So you can vote every day until November 20th. You put my email in there? Yep. Okay, that
Yes,
works.
ma'am.
Yeah. And yeah. So I would love to hear from any of you. If y'all have questions about Count the Kicks, feel free to reach out. If you want to say hey, feel free to reach out. If you want to follow us, we're on Instagram. I don't tweet, but I'm up there. Not a tweeter. I don't even think it's not even Twitter anymore, but whatever. So Instagram, Facebook, we're on all those things. I do TikTok videos every now and then, but don't hold me to that. So would love to stay connected. And thank you so much, Stephanie, for having me. I love talking about this
Oh.
stuff. I love educating people about preventative measures, things that we can do to prevent things. So thank you. I appreciate y'all got for listening and being here and wanting to know more. Thank you.
Thank you. Let's give it up for Tamika one last time. Thank you. For those that are on, I want to just remind you to make sure you fill out that link. Until next time, contact the Shades of Motherhood if you were interested in partnering any kind of way. We're going to be having the first subscription link that will allow doulas to get all kinds of resources. Also, too, if we have enough doulas in a certain community, we will help get resources as well as apply for grants so that you can be supported the same way that we are able to support our doulas here locally. And we're just getting started. We have a business doula that's going to be doing a lot of things around business development and support and mentoring. So please take a look at those resources, and we hope to see you in the future at our next event. Thank you.